Obamacare truly affect our doctors and you, the patient?
Stand back. I'm going to introduce Dr. Siegel. He is he's our medical contributor. Dr. Siegel, Medicare-For-All. We understand where people's heart is. They want to give Medicare for medical coverage for everybody. But this is not reality, is it?
Not only that, it's not really Medicare. By the time you're done with it, you're looking at a system that's somewhere between Medicare and Medicaid, number one. Number two, you lose all the choice that you have under the current employer-based healthcare system, which is covering over 170 million people. They're not going to all
You can't have both. You can't have private and you can't have Medicare.
Not under these plans, you can't.
What do you mean choice? What, you can't choose your doctor?
You can't choose your health insurance plan. You can't choose your doctor. You can't choose where you go for care. You're dealing with narrow networks. They're going to muscle everybody into supposedly taking it.
So the government could send you to the worst hospital, the one that has the worst rating, and you have no choice.
Absolutely. Not only that, doctors will be paid about 40% less, and hospitals, listen to this, Ainsley, currently make 85 cents on a dollar with Medicare. All of the research that goes on in medical centers, all of the teaching is based on private insurance supporting it. You take that away, and you end up with less research, less innovation, less new drugs, less, bright-eyed medical students graduating.
Let's see the hands here in the studio audience. Bernie Sanders has suggested that people would be willing to pay more in taxes for Medicare for all. Let me see the hands of the people who would pay more. Okay, nobody on that side. How about the other side? How many people would pay more for taxes for Medicare for all? I don't see a single hand.
So here's why, Steve. People say, it sounds great, 58% support it, sounds great. But then you say, what's it going to cost? $30 trillion over 10 years? The hands go down. Will you be able to have access to your physician or the health care you need? Hands go down when you hear that in Canada, which is single payer, you have to wait several weeks for an MRI, for a CT scan, for a hip replacement, or to see a specialist. Who wants to wait several weeks to see a specialist?
Yeah, I mean, you talk to the Canadians and Brits, they have a lot different opinion than Bernie Sanders has on them because he thinks they have it made. You can't have Obamacare and Medicare for all. Do the Democrats realize that? While lauding Obamacare, they talk about Medicare for all. That's where these candidates are going to divide, by the way.
That's where they can't have it both ways. And I think that they're going to realize, I think it's a campaign slogan, Brian. I don't think it's ever going to happen. I think they're going to self-destruct by getting behind it. I can't believe they're making it a campaign issue. It is so unpopular.
Because health care is number one among most people's concerns. I'm sure even in this audience.
Raise your hands if you want to destroy the current health care system and replace it with something which may not work.
I don't see any hands.
We think of our parents, because many people are taking care of their parents now. My mother had a stroke. You helped me through that. If she had gone to any other hospital in our hometown, she went to the trauma hospital. But if the government said you have to go to that hospital and not this one, she would not have made it. Because the one doctor who could perform the surgery on her brain to remove the clot was at that one hospital, and he happened to be on call that night. If she went to another one, I would be motherless right now. We think about our little kids. If something happened to my daughter, I want her at the best hospital. I want her with the best doctors. I don't want the government telling me where she has to go.